Fabi.
Nice to see you both.
Let's start with what exactly is basal cell carcinoma?
Yeah, so it's actually the most common form of cancer. And in fact, an American in the United States will be at risk, at least 1 in 5 will have some form of skin cancer in their lifetime, usually before the age of 70. The population that's greatest risk is Caucasian males. And so a basal cell is an overgrowth of a type of skin cell found in the top layer of the skin. And it's the most common form of the 3 types of skin cancers that we see. Luckily, it's also it's the form that grows the slowest. And so in that way, you don't worry so much about it ever metastasizing. But if you let it sit there for long enough, it can metastasize, and the rate is up to 0.5%.
Does a basal cell look different than other skin cancers that may be overlooked because it doesn't present itself? Is that serious looking?
I'd say that it can be overlooked to be maybe a mole is usually what I get, like a skin-colored or a flesh-colored mole. It can be kind of red or irritated because you've been scratching at it and you thought it was like a pimple or something that irritated you for a while. It can have some overlying little blood vessels to it, which usually differentiates it from, let's say, a skin-colored mole, like the photo that you see right there. Some may just think, oh, I've had it for a year or 2 and it's not really growing, it must not be anything. Or it might be like a little rosacea bump. Others can have it be more pigmented or brown. So you think it's like a brown spot or something that you got from the sun, which you did, but in this case, it's not a good spot that you got from the sun. Others can actually look almost like a scar, like we saw in that gentleman's temple. And so you might think that you got it after you had something burned. And so you kind of disregard it, but it continues to grow. And because it grows so slowly, people generally write it off like it's nothing. And so that's where the deception can lie.
So do we see it more here in California, places where you see a lot of sunshine, and what can we do about it? So as far as prevention, and at different ages, obviously different people get at different parts of their lives, and also once you do have it, what do you do about it?
Yeah, so the greatest risk is people that have had a lot of sunburns. So if that means people that have lived, in Southern California most of their lives, that could be. But those that live in the Midwest still, get that intense sun for the summer and get more sunburns perhaps than someone in Southern California. So number of sunburns. Also being exposed to a lot of UV. And so we do get that because we have sunshine a lot of the years of a lot of the days of the year. So between 10 to 4 p.m. that UV is most intense. So our surfers, our rowers, our cyclists that are out there a lot. Having blonde or red hair puts you at greater risk as well. And people that have had a lot of sun tanning bed exposure. So even if you had that tanning bed exposure like 10 or 15 years ago, you're at significantly higher risk of developing something like a basal cell later in your life.
And I want to touch back on what you were talking about, people of fair skin. My mother, I'm very familiar with skin cancer, get yearly checks. My mother's a redhead. I've lost 2 friends. I grew up in Arizona, one at 55, one at 28 to skin cancer. And I think we need to also raise kind of the misnomer that people of color don't need to worry about it, because my friend who passed away was Latina.
Yes.
And if you would have set me, who's kind of pasty and Irish, next to her, who would you think would get it? You would think it'd be me, but it was her.
Absolutely. So and being Latin, I can tell you that you think that because you have a little bit more melanin in your skin or a little bit more pigment to protect you from that UV damage, that you're not at risk. And you may not be at great of risk, but that doesn't mean that you're completely void of risk. And so generally there have been studies that have come out of Miami that showed that those that have more melanated skin or more pigment in their skin, specifically Latinos, tend to present with their skin cancer at a later stage than their Caucasian counterparts, because they believe that they tend to tan more rapidly. They rarely burn as much, but still that UV damage does accumulate over time. So ways to prevent it, to your point, are yearly skin exams. Especially if you're a male over 50, you should be definitely getting them. That's the population.
And men aren't as good about putting on sunscreen. I'm always on top of my son and my husband about that.
Exactly, because I think for some...
Guilty, no, guilty, very guilty.
Are we right?
Yes, I feel like you guys are looking at me and I'm guilty, yes.
I'm like, put it on.
Wearing a mineral-based sunblock, so something that has zinc oxide and titanium dioxide, that SPF has to be greater than 30. 30 or higher. And remember that it wears off. It gets absorbed or sweat off, usually within 80 minutes. So you have to really get into the habit of reapplying. When people tell me they apply it every morning, that really doesn't mean much to me, especially if you're living an active Southern California lifestyle.
Before we let you go, I want to ask you about the president real quick. He's an 80-year-old man. They were able to get it and say, you know, it's cancerous, but no big deal, but you know, relatively speaking. Why is that? What, did they catch it early? Is that the case?
And it's because it was so slow growing too, right? And sometimes certain areas of the body, especially if you have a lesion around your eyes, you know, where it can affect when they cut it out, tissue that's going to affect function of your eye.
And I think the First Lady just had that too, right?
Right. You have to be more mindful about just letting something like that go. In his case, it was caught early. Now you usually are at greater risk of getting your second one, we have found, within those first 2 years. So you have to see your dermatologist every kind of 6 months after the diagnosis of one for the first couple of years to make sure you're getting total body skin exams and you catch anything that might also